Welcome to Nz-Osce learning sessions. Today we will go through Station 5, Emergency Skills Assessment and Updated version. Please read the scenario carefully for 2 minutes. Here, the practice setting is a sports academy, and you are a nurse by profession. You are required to manage an unresponsive child whose name and address are unknown. Our recommendations are: begin by assessing the child and escalating the situation by calling the emergency response number 111. Instruct someone to get an AED and arrange for an ambulance. As always, enter the scene by first checking for safety. If the scene is not safe, make it safe before proceeding. And ask the bystander what happened to this child. They will inform you that the child fell down while skating, but they have no further details regarding the child's identity or ethnicity. Okay, you have to reply that I am a nurse by profession, don't worry, I know how to handle this situation. You have to assess the child's responsiveness by tapping the shoulder firmly and asking that, are you okay? Are you okay? If not responding, you have to give instruction to that bystander that could you please activate 111, bring AED as early as possible and inform the ambulance team to come. You have to give clear instructions to the bystander. Meanwhile, checking the airway by head tilt and chin lift maneuver and also look for any foreign body. How you will assess the child's breathing pattern by look, listen and feel method. Simultaneously, you can check for carotid pulse. Once done, begin compression by placing the hands directly over the sternum. Fingers crossed, elbows straight, shoulders should be directly perpendicular to the victim's chest. Push hard and fast about 2 inches or about 5 centimeter depth. Since this is a child, ensure compressions are no deeper than 2 inches or about 5 centimeter depth. Deliver 30 compressions and 2 breaths. As it is a pre-hospital scenario, you have to give 30:2 breath and the bystander is a layman. Continue compression and breaths until AED arrives. Once AED is available, please request him to start giving compression and inform them that let me operate the AED to analyze the rhythm. Okay. Then he may reply that I don't know how to perform it. No worries, I will teach you, follow my instruction. Place your hands like this, fingers crossed, elbows straight, shoulders should be directly perpendicular. Push hard and fast about 5 centimeter or 2 inches depth. Am I clear to you? After 30 compression, I will give 2 breath. If the child is very small, you can use one hand to compress. Begin operating the AED promptly. First, turn on the AED. Then locate the AED pads. If child pads are available, use them. If not, you can use adult pads. Apply the pads one just below the clavicle and next few inches below the armpit, that is 6 to 8 centimeter from the armpit if we are using adult pads. If available the child pads, you can place in the antero-posterior position like center of the chest and posteriorly behind in between the 2 shoulder blades. Okay, let me explain it again. If only adult pads are available, place them in the anterolateral position. Once pads are attached, connect the cables and allow the AED to analyze the rhythm. If the rhythm is shockable, clearly you have to verbalize that all clear before delivering the shock. Proceed to shock with a countdown of shocking in 3, 2, 1, then shock. If the rhythm is non-shockable, immediately resume CPR. As you continue CPR, you hear the approaching sound of the ambulance. Once the paramedic arrives, they assess and say, I can see some signs of life. Please stop CPR. Then they ask you that what happened to this child. At this point, you should give a handover using ISBAR tool. Okay, let's see. I'm a paramedic. I will take care of him. Let me check his pulse. Oh, I can see signs of life. Please stop compressions. Great job. And could you please update me on this child? At this point, you should give a handover by using ISBAR tool. Always maintain clear instructions and reassure the bystander throughout the process. I am so and so, a registered nurse. I found a child who collapsed when I entered the sports academy. His name, age, ethnicity were unknown. I assessed his responsiveness, checked his breathing and pulse. There were no signs of life. I recommended to activate 111, bring AED and inform ambulance team as early as possible. I given so and so cycles of compression and given how many shocks that you have to say, or it was a non-shockable rhythm. I'm really happy to help you further. So you given a proper handover. Once you done given handover, they may ask you that what may be the possible causes of the child to get in cardiac arrest, or what do you think? What happened to this child? So you have to explain the possible causes. In child, a respiratory failure, that is a main reason due to hypoxia, or any airway obstructions, maybe because of drowning, any infections, any smoke inhalation, or aspiration also can lead to cardiac arrest. And for some, by birth itself, some congenital heart defects that can lead to cardiac arrest, and also abnormal heart rhythms due to channelopathies or structural heart abnormalities. Other causes are myocarditis, cardiomyopathy, any trauma that can lead to a child in a arrest. At the same time, in infant also, respiratory infection or any respiratory distress due to hypoxia that can lead to cardiac arrest in infant. But in the adult, coronary artery disease, that is the main leading cause of cardiac arrest in adult. And also heart failure can lead to cardiac arrest, and different arrhythmias, bradyarrhythmias or a tachyarrhythmia can lead to cardiac arrest. Other factors include any infections in the cells, myocarditis, or any drug overdose that can lead to cardiac arrest, or any trauma. These are the possible causes that can lead to arrest in child, adult and infant. So they may ask you definitely after the handover what may be the possible cause that leads to this child in an arrest. So keep all these points in mind. You can perform the station confidently.